Hey guys, I want to talk to you about cupping. It is something that I recommend for patients to improve the feeling of scars or area where there's tissue that has fluid getting trapped in the tissue. And I find that cupping has been a really nice addition to scar therapy and just overall healing from tissue after surgery. But I'm going to preface this with you want to get your surgeon's okay before you start any kind of cupping regimen. So not everyone is down with this idea, or you may have certain circumstances where they don't want you to do it. So make sure you check with your surgeon first. But the idea behind cupping is it really stems from Chinese medicine, where small little suction cups are used, and they would use fire to create the vacuum. And it suction down onto the tissue and help draw out, draw blood supply to the skin and the underlying tissue, as well as mobilize the debris that's in the tissue. And the reason why I like to use it is because it helps to flush out any of the stagnant fluid that gets trapped, or particles in the space between the cells, kind of helps flush that through. So there are licensed Chinese medicine specialists who can do cupping for you. However, they do make home devices that you can purchase online on Amazon, and they can be really pretty easy to use. So this is what I recommend to my patients. Here's an example of two different kinds. This one is a silicone cap that has an area here that you squeeze to create the suction. And then this one is just ergonomically a little different, still creates a suction when you squeeze it, but for certain people this might work out better for the way their hands are designed. But generally speaking, I recommend that my patients obtain this kind of silicone cup. Now, there are two different methods of doing cupping, at least in this kind of setting, that I have noticed. The first type is when you put the cup on and just hold it in place. So to create the vacuum, you're going to squeeze the top of it like so. And then you're going to place it onto the area that has a scar. Imagine this is the abdomen or something. And then you withdraw the top so that it creates the suction there. So you can see it's suctioned. There you go. Now you can leave it in place for 30 seconds to a minute and then take it away. And the longer you leave it in place, you'll notice some kind of redness that will slowly go away. But the other way that I like to recommend my patients use it is with a little bit of oil. Now I will often just say use coconut oil or some kind of something easy and just warm it up. But you just want to cover the skin with the oil, and then you will do that same push down technique where you create the suction, and then with the oil that will facilitate you moving it along the tissue. So you're dragging that suction, and don't worry if it pops off. You just kind of pop it back on, and you're going to move it down. And see how I'm getting kind of a red reaction? Kind of blotchy. That's okay. This should not hurt. And the more you do it, the better you'll get at it. And I recommend that people do it at least twice a day. So see how it's really stuck on there. So you're going to do it twice a day for about 3 minutes a session. You just kind of work over that scarred area. Same thing with this type of device. This one's a little big for my arm, but it's the same concept. You're going to squeeze it like this, and then when you let it go, it suctions up the tissue. It won't do it on my arm, but same principle if you use this type of device. So again, cupping is for scar treatment, and you might even get little things that look like hickeys. They're not really hickeys, but the reason I like this is it's something people can do at home. It brings healthy blood vessels and blood flow to the tissue that gets kind of stuck after surgery. It helps to flush debris and dead red blood cells that get congested in the tissue and bruising, and then also helps to provide some lymphatic drainage and flow from the stagnant fluid that's within the tissue. So that is my tutorial on cupping and why I like it so much, and a little demonstration on how to do it. Feel free to call my office anytime if you have any questions or thoughts about this, or like I said, if I am not your surgeon, I recommend that you talk to your surgeon before instituting anything like this, just to make sure they're okay with it. All right, have a wonderful day.